All right, good afternoon, everybody. Thank you very much for being here this afternoon. This is a collaborative resource sharing session between Family Connections through our ADAPT Coalition and the Partnership for Children of Essex. For those who don't know me, my name is Joel Torres. I'm the manager of ADAPT, and I'm very happy to have you here with us. We also have most of our team here from ADAPT on the call just to follow up and check on the chat box just in case anybody's typing any questions into that. And we have Erica here from the Partnership of Children of Essex. And we'll do a quick introduction into our agencies and our programs. But just real quick, some housekeeping for today. This session will be recorded, and we'll be compiling it into a YouTube video to share with the broader community, because this is the invitees, or the people who are invited to attend are just the folks who are sharing their resources and sharing their information. So we want to make sure the information gets to the broader community, and we will share that through a video made available by Thursday at the latest. Along with that, each participant has received their number, if you want to call it that. So at what number you drew to present. We're looking to do this on a consistent basis as long as the pandemic is affecting us, to make sure that we can provide our community with what resources are available out there. And each person will have about 5 to 6 minutes to speak about their programs, their agency, what they have to offer. At the 1 minute mark, I'll keep a timer. At the 1 minute mark, I will just respectfully interrupt you real quick and say you have 1 minute left, and then stop you at the 6 minute mark so that we can move on to the next speaker. As we move on through this presentation, I have everyone's name, title, and email address listed as well. And if you are the next person, Julia will send you a private message just to give you a heads up. Hey, you're the next person that will be speaking. So with that said, without further ado, once again, thank you very much for being here. We appreciate you taking the time to present on what you will be discussing. I'll pass it on to Erica real quick so she can kind of give you a highlight of what we expect from today. Erica came out with a great idea of having this event and partnering with ADAPT to make sure that we can continue to share resources during such a challenging time for all of our residents here in the county. So with that said, I'll pass it on to Erica real quick to highlight the need for this event.
Good morning, everyone. Can everyone hear me?
Yep.
Okay, great. So my name is Erica Rowe. I'm the Director of Community Resource Development for the Partnership for Children of Essex. Yes, we came up with this idea because I'm just so used to giving, resource forums, a place where, we can actually share resources with one another within the community. But being that we are in this crisis with COVID and everybody is doing everything through video, we figured, let's bring this to video and we can still share resources. So that's the whole purpose of this. Just wanting to know what everyone is doing during this time to help support, the children and families here in Essex County. That's basically the goal of this. As Joel said, we want to continue this. This is the first one that we're having, but throughout this crisis, I think it's really important that everybody knows what their resources are here in the community. So without further ado, I think we can move forward.
Thank you. So just real quick, since we're hosting it, we just want to give you some background information on ADAPT if you do not know who we are. ADAPT, we are a countywide coalition here in Essex County working on substance abuse prevention. Other than our 5 staff members, thankfully, we've grown from staff of 2 to now a staff of 5. Our staff work tirelessly to support our volunteers in substance abuse prevention efforts in committee work, because a lot of the work that we do is collaboration in committees. And our focuses are on programmatic and policy changes here in the county. And with the pandemic affecting all of us, Our biggest goal and our biggest strength has been face-to-face communication, meeting with all of our partners and trying to find out ways to collaborate. So we've been working on innovative strategies to kind of enhance the work that we've been doing. One of the biggest hits that we saw from the pandemic, other than the face-to-face communication, is the big headway that we've done over the past 8 to 9 months with our older adult population. We won a grant for curriculum-based programming with the older adults, a 6-week program. The long-term goal is to reduce prescription medication misuse and abuse, but then also another goal is to increase health and wellness for the population, for the older adult population. We saw a hit with that with the pandemic because, as you know, one of the most vulnerable populations are our older adults. So we have Julia Revorredo here, who is our coordinator for older adult services, and her team is looking for innovative strategies, and they're looking to create a care package to give out to the local seniors. And if you'd like to be a part of, if you have any resources or information for older adults, feel free to reach out to Julia. I'll ask Julia to drop her email in the chat box just so that you can reach out to her. For those who don't know, we are managed by Family Connections, and Family Connections has been around since 1879. They have a host of programs that are now being promoted through telehealth services to expand the support here in the community. And moving forward with the sessions, we will make sure that we have a representative from Family Connections on the line to present more on the programs that they have available. So without further ado, I'll pass it on to Erica to highlight what's available through PCE.
Thank you. So the Partnership for Children of Essex, we have been around for 16 years as a part of New Jersey Children's System of Care, and we are providing care management services for youth and families in Essex County. So those youth that tend to struggle with mental health, substance use, and those with developmental disabilities are those that we are currently serving. We serve youth between the ages of 5 and 21 years of age. We've had some of our families or youth a little younger than that, but our basic age is between 5 and 21. And we provide care management services for these youth and families. So these are services that, that are out in the community that we have established contracts with, that are able to provide the actual hands-on services for these families, and we manage the care of that. This is a wraparound approach, so it's not a cookie cutter situation. All the services are individualized to that particular youth's needs. We're very strength-based, we are community-based, and we need providers like yourselves that are hopefully on this call to do the work that we do. So all of our referrals must go through Perform Care, which is an 877 number. It's a central hub, but we don't want that to scare families. So we actually can assist families in getting the services that they need and walking them through the process. So again, Perform Care is just the state hub. It's an 877 number that's provided here, where families would get triaged over the phone, and then someone will actually come to the family's home to do an assessment and see if our services are warranted. We are working with the highest level of children with needs. So if Perform Care does not feel that this is a high level family, then they will refer the family to basic community resources. However, we have access to resources that the community does not have. So again, we are serving the highest level of children's needs within the Partnership for Children of Essex. So there's a care management organization in every county through the Children's System of Care, but Essex County happens to be the largest. We average serving between 1,400 youth at any given time, and there's never a waiting list. So even during COVID, we are using telehealth for services. Seems to be working fairly well. So we are fully operational and ready and willing to take any referrals of any youth that seem to be struggling within the community. I mean, it's difficult right now trying to make sense of what's going on, COVID, et cetera. We know that there's, you know, various issues that may be happening within the families, anywhere from abuse, domestic violence, all of those things as children try to make sense of what's going on, families as well. So I just want everybody to know that we are fully operational and open. If you have any questions, you can feel free to contact myself. There's a 323 number. So 973-323-3000 is our office number. Again, where we can walk families through the referral process in contacting Perform Care. You have to go through Perform Care in order to get our services.
Thank you, Erica. Another, just quick, another housekeeping thing, just in case you might not be allowed to be recorded and shown on video by your agency. I know there might be some requirements by different agencies. Feel free to just note that before you begin. I have the capability to cut out a certain piece of it, of the video, before we put it live on YouTube. That's no problem. We can edit the video and make sure we cut out your piece. We want to be respectful to any requirements you have as an agency. So just thumbs up, we're good with that?
Sure.
Okay, just want to make sure.
That's fine.
And just real quick, before I just pass it on, I forgot to mention, ADAPT does not only work with older adults, we also work with other populations through all ages. We do have initiatives that we're working on with youth right now. And if Jessica, if you could just unmute yourself real quick and just highlight some of the work that we're doing with Incorruptible Us or Incorruptible Essex and our youth.
Okay. Hi, good morning, everyone. We do work with the youth ages 13 to 18 on tobacco prevention and cessation prevention services for youth in Essex County. Our group is called Incorruptible.Essex. It's part of a statewide program created by Tobacco Free New Jersey under the Department of Health. And what we do is we meet with students, we meet with youth every month, and we talk about different initiatives, different activities that they can do to prevent youth from starting to access vaping and tobacco products. Vaping is the new tobacco product right now that a lot of youth are using. We saw in the past 10 years, we saw a big decrease in cigarette smoking, but now vaping has taken over, and we're seeing a lot more youth using the Juul and other products. And so what we're doing is a social media campaigns to combat the misinformation that vaping companies and big tobacco companies market to youth and the public. And so we use, we work with the students, we educate the students, and we also do different social media campaigns. We have 2 platforms. We have Incorruptible.Essex and Instagram and Facebook. And so what we're doing now during our social distancing time is we're creating content almost every day, and also giving away. Every Monday we have a giveaway Mondays, contest where youth are able to create social media contests or do some little activity like posting and tagging. Every week is a different theme, and then they're eligible to receive different prizes. So this week we are promoting, it's Clean Air Month, it's also Mental Health Month. We already had a contest for youth, and adults can do it too. I mean, they just won't be entered in the contest. But we had a self-care bingo, so taking a time to understand the importance of self-care and taking care of yourself during this time. So it's fun little activities. And then this week we're promoting Clean Air Month by having kids create content to promote clean air, why it's important both for our health and for the environment. So all our details are on our Incorruptible.Essex Instagram and Facebook pages. What else? And then if you have any youth that would like to join us, just they can email me. I'll send my email in the chat box. So any youth in Essex County who reside or go to school in Essex County ages 13 to 18 are eligible to participate in this extracurricular activity. They can get it looks good on their resume, on their college applications, and they can get community service hours as well. Thank you.
Thank you, Jess. All right, so without further ado, we're going to start with our presentations. And I will ask Kaylin, our very good buddy of ours, very great partner from the DEA and NYNJ HIDA. Kaylin, you can introduce yourself, and then I'll start the timer as you start speaking.
Joelle, that was such a lovely introduction. My goodness, you're too kind. But as he mentioned, my name is Kaylin. I am one of 2 demand reduction specialists for DEA and New York, New Jersey HIDA, which stands for the High Intensity Drug Trafficking Area. We do the education, prevention, and outreach in New Jersey. You know, a lot of what we do, actually most of what we do is in Essex County and Newark, but we do work throughout the state. Most of the resources that we have to offer honestly aren't ours. We're much like the liaison between different organizations and just the information sharer, spreader, however you want to, whatever word you'd like to input. That's a lot of what we do. So the first resource that I have that has been a fan favorite during this pandemic is the New Jersey State Police Resource Guide. I actually sent it to you, Joelle, a few weeks ago, but it's actually updated biweekly and it's now available in Spanish. All of those resources are listed by county, and I actually listed what they have to offer because it's a lot. It's like 70 pages long. So it includes testing sites for COVID, where to access Narcan, recovery support services and resources and meetings, mental health resources, grief support, crisis hotlines, social services resources, food banks and emergency shelter information, senior services information, resources for veterans, resources for first responders, resources for college students who may not have a place to go, scholarship information, places where they can store their belongings, as we know a lot of students had to leave college early, leaving them without a plan. Job search resources, information for businesses and employers, information for home expenses, in-home education resources, the list goes on and on. There's a lot more, but my computer actually just timed out, my other computer. So that's one resource that we try to spread everywhere just because it's so comprehensive, it's so in-depth, and like I said, it's by county, which is super helpful because Essex is pretty big, and so all of that is listed out, and like I said, it's now available in Spanish and is updated bi-weekly. We also offer Operation Prevention, which is a DEA resource in addition to Discovery Education. And that is a curriculum for 3rd grade through high school students that talks about the science of addiction, opioid use, and as we know, students are gonna be out of school for the rest of the school year. And so if parents are looking for ways to engage their child in something different from what they're doing, I'm not really sure how different schools are utilizing this virtual learning. I know for Newark, a lot of students just received a packet for the end of the school year, and they just had to finish this like 400-page packet. And so if, you know, those parents need additional resources for their students or for their children, we do offer that. It includes worksheets, a virtual field trip, a self-paced module. It includes notes. It's very in-depth, and it's also available for the workplace as well now too, for any workplace that might be interested in substance use and the science of addiction. And the last, I guess, resource, maybe opportunity, whatever you'd like to call it, that we have to offer. We actually have our art exhibit coming up in September. It was supposed to be this summer, but you know, things are changing, as we all know. And our art exhibit, it's the heroin and opioid art exhibit, and any person can submit a piece no matter the age. I think the youngest we've had is like 8, and the oldest we've had is in their 70s. So there's no age limit as long as whoever's submitting their piece has some sort of heroin, opioid, drug use message to it. They are allowed to submit. You know, we know that isolation breeds, addiction, that it just comes back, whether you were in recovery or, suffering from substance use disorder. And so this could be a good opportunity for anyone to submit a piece if that's what they're going through. We don't really have a lot of Essex County residents submit, so this could be a great opportunity for us to get that number up. So if you have anybody or anyone who may be interested, please feel free to send them our way. And I can also include the link to Partnership for Drug Free New Jersey's website. They are the ones who accept the submissions from all of the artists. And if you would like to be included in the New Jersey State Police Resource Guide email that we try to send out, I can include my email in the chat, even though it's right in front of me as I'm looking at it. And you can just let me know, and I'd be more than happy to send it to you. And that's all I have.
Thank you. Kaylin, can you also just quickly highlight the Handle with Care initiative that's
so one program that we have that was actually supposed to go statewide on April 7th, but COVID happened. The Attorney General was supposed to do a press announcement, and we were very excited about it. But it's a program that we created, and it's based off a model from West Virginia called the Handle with Care. And basically what that program entails is anytime a police officer is called to a scene and there's a child present, they fill out a notice basically just saying the child's name, age, grade, where they go to school. And that police officer then sends it to the school that the child attends. So that way the school has some sort of awareness that something that could have been traumatizing happened to that child last night, and not to necessarily address it if it's not, if the child doesn't want it to be addressed, but just to keep an eye on them. For so long, myself included, when kids are dealing with something traumatic, they don't necessarily say, I experienced a traumatic event last night. They act out, they become very distant, they zone out, they don't want to participate. And for a long time, those students were reprimanded because the school had no awareness that something could have happened to that child. And so this program is basically a link between the schools and the police department. So that way some services can be provided to that student without reprimanding them based off of what they experienced. It's in Newark, it's in a few other counties. Like I said, it was supposed to go statewide on April 7th, but unfortunately with this pandemic, everything has been kind of at a halt, especially now with schools not, being in session. There's there's definitely a lot going on in these children's lives that unfortunately we're not being able to connect because those schools, aren't in session. But we're trying to figure out a way to address that concern because it's looking like that'll be the reality for a bit. But yeah, that's what that is.
Thank you.
Yep.
I think the folks on this call would find that as a useful resource, that if we can promote that to our local police departments, it'll be a way of just making sure some young individuals who might end up being quote unquote troublemakers and just labeled that way or just suspended, you might be able to provide services and resources to them because the school might find out that they're dealing with a challenging situation at home or something like that. So FYI. Thank you very much, Kaylin.
You're welcome.
Next, we have, I think Jacqueline's not on the call right now, so we're going to move from Jacqueline to Elizabeth Marks. She's the County Alliance Coordinator here in the County of Essex for the Division of Community Health Services. So Liz, you've been around for a while. You've helped us collaborate with the alliances. So I'm going to unmute myself to give you the time to speak about the work of the alliances and some of the partnerships that we can do together.
Sure. Good afternoon, everyone. Again, thanks, Joel. My name is Elizabeth Marks. I am the Essex County Municipal Alliance Coordinator. So I'm just going to give you a little background of the municipal alliances and the way they're funded. So the municipal alliances are made up of volunteers from every from that particular municipality, and they create what's called a need assessment to determine what the needs are in the community that they live in. The different partners that are on the municipal alliance are police officers, teachers, different volunteers within the community. And we are funded through the Governor's Council on Drug and Alcohol. And that's called, the acronym is JACATA, because we have a million acronyms. That is JACATA. So in Essex County, currently, we have 18 municipalities that have municipal alliances and one consortium. That means that there's 2 municipalities with it. So a total of 19. We currently are don't have 2. One of the biggest that do not have an alliance, which is Newark, but we're working with the DEA and ADAPT to get them back on board. And also Essex Fells does not have a municipal alliance currently. So the different municipalities, they do different prevention efforts for preventing drug and alcohol abuse. So there's about 500 programs that they initiate within Essex County. It's all individualized based on the need of the community that they live in. Some of the different programs that they do parent workshops to help parents with healthy living, drug-free lifestyles. They do peer leadership programs in the high schools and middle schools, and some in the grammar schools as well. They also have different events, drug and alcohol awareness events that they have throughout the year, some with the police, some with ADAPT. They also do different programs with older adults. And we also work with ADAPT very closely because a lot of the municipalities will use their WISE program, and they have different other programs to engage the seniors to participate, as well as using the youth in the peer leadership groups to work with the elderly population as well. They also do different programs with the younger students, like grades, so that they are, they do mindfulness, they do evidence-based programs. They also do DARE or LEAD, which most people are familiar with. So those are just some of the different programs that are within the different municipalities, but keeping in mind that each municipality has different needs. So basically the county is in charge of overseeing all the physical programming and the programmatic programs. We also do countywide events, which we work directly with ADAPT, and also we work with our prosecutor's office, and we also do work with the DEA. We do, right now, we were supposed to be doing a teen summit in the spring, with ADAPT, but that's been postponed. We also do trainings for our different municipal alliance coordinators on different topics of drug and alcohol prevention and evidence-based programs too. We work with our drug and alcohol committee as well, so that we can provide the prevention efforts and also introduce the treatment aspect of what the county has to offer as well. That's pretty much it.
Thank you, Liz. Appreciate that.
Thank you so much for having me.
We'll come back to Denise. Is Isabel Martinez on the line? I don't know if did I see Isabel? No, Isabel's not on, so.
No, Isabel is not on, Joel.
Okay, thank you.
Mhm.
All right, we're gonna move on to Mr. David Kerr. I do see that David is on the line. He's the president for the Recovery Advisory Group. And David?
Greetings.
There you go, David. All right, perfect. I'll mute myself.
No, I appreciate being invited. I very briefly, I started in this business in 1965, helping parolees who were addicts, and it was a new deal at that time, the addiction part of it. And then in October of '68, I founded Integrity House. And Integrity House is in Newark and all over the state. Integrity House now serves 3,000 people during the year. And I'm retired, however, since 2012. I work with a group called the Recovery Advisory Group. And and the other thing I do is I write music. I've just finished my 10th symphony, and I'm working on The Road Least Taken, Robert Frost poetry, putting that to music. And the reason I mention that, because I'm putting a message in my music now, about, I think someone mentioned it, Joel, you might have at the beginning, the word isolation. So I'm here just to kind of give some information based on my experience. And one of the things, since it came up already, is the word isolation is more and more prevalent in the argot of today. If you don't isolate, you might get the COVID-19. Now the situation, the word isolation is exactly what addicts or people who are prone toward using tend to do, and isolation is the enemy of recovery. So one of the things that I think we have to be creative, and necessity is mother invention. I love this format with the video and the virtual format, because I think we can reach. When I see people now, I see them through video, Skype or Zoom or whatever, and I can't really help someone at all over the phone or by voice. I have to see them. I have to see the reactions to what I'm saying, and then also develop a relationship as much as you can over the internet. So what I'm seeing right now is we're all hearing about the COVID coronavirus problem, but underneath it, in huge dimension, is the epidemic of heroin, and also the pharmaceutical drugs, the OxyContin, hydrocodone, and so on. So we're kind of smothered right now in our society, in our culture, by addictions, and they can be IV or orally or whatever. So my suggestion is to do more of this, Joel, more interacting with people, video interacting. I think the County of Essex could be very, very instrumental, very helpful in this type of format, bringing out people talking from CUDA, from Integrity House, from different programs, and giving the message that they see right now in terms of what the problem is, who's coming in to be helped. I'll say one final thing that is a real problem. And the problem is that the funding is shorter and shorter, less and less. And I understand that the state has limited funds, or the federal government. However, the addiction pandemic is relentless and doesn't respond well to quick fix treatment. And so what I'd like to say for anyone who wants to hear this is the recovery process is 5 years, not 5 months, 5 years. If you stop working with someone before the 5-year period, you're kind of just dropping them off into a sea of cultured, quick fix drug use. and you're liable to just turn everything back again. And that's exactly what's happening right now. People hit the prisons. I've been on the phone with Marcus Hicks, DOC, and also Sam Plumeri, the parole chief. I'm pleading with them. We have to assure people stay in recovery for years, not months. So that's kind of my message today, to let people know how much of an epidemic this is, and I would call it a pandemic. But it doesn't respond to quick fix, because what happens is I could talk to someone for a few minutes and they would be motivated for the next hour. But as soon as they get back into their stream of friendship and so on, they're back on the drugs. So thanks, and stay in touch with, I'm happy to help.
Thank you, David. Much appreciated.
Mm-hmm.
Next, we have Gino Arevalo, the Regional Director for Family Intervention Services. I want to thank Gino and the team over at Family Intervention Services, because they actually were the last location that we were able to host a coalition meeting right before all the restrictions went into place. So with that, I'll put myself on mute and pass it over to Gino.
Hey, good afternoon, everyone. Hope everyone is safe. Everyone is doing well under the current circumstances. Very difficult for our families, for ourselves. So my heart goes out to all of you who continue in the front lines, and wish you to stay safe. So Joel, thank you for inviting me. It is a pleasure to, I guess, reintroduce and remind people of our services. So just a brief history of our agency. Family Intervention Services was founded back in 1981 by Gene Warnock, who started in Morris County with very few programs, and they were contracted through the division. And they were simply contracts to keep those children who were displaying behavioral challenges at home instead of sending them in to facility. That was the trend back in those days, and FIS managed to convince a lot of people that it was not only cheaper, if you want to look at it from the financial perspective, but actually better, because after years of being in the field, you learn that trauma is something that lasts forever. So that was back in 1981, and we have grown into 4 different counties: Sussex, Essex, Morris, and Passaic. And our agency's, I guess, mission is as simple as it can get. Families come first. You meet the families where they're at. In-home services. We coordinate from concrete services, transportation, clinical, advocating, and different programs from mobile response to outpatient to supervise. So we have a bit of everything. We are a nonprofit. We are definitely child and family centered. We come from a strength-based family systems approach. And it's not just simple that we apply that philosophy to our families, but also within the community. We always believe in parallel process. In the community, if you have good relationships, trusting relationships with other agencies, other people who advocate for people's rights and go do well by them, we believe that it's just a reflection of their beliefs. So, and we also are a trauma-informed agency, and we have our own institute of training to provide CEUs and certifications for clinical supervision. So just going to definitely highlight what we do in our in Essex County. As the regional director, I oversee the programs in Passaic, and I oversee the programs in Essex. So in our Essex office, located on 86 South Harrison Street, in East Orange, we have our child, teen, and adult outpatient programs. And we, as everyone is doing, we are using telehealth. We've discovered the many challenges, as you all know, that not every family in Essex County, particularly in urban areas, have access to a computer, tablet, Wi-Fi, things that we take for granted. So a lot of the sessions are being done in the best way possible because of the regulations that have been a bit relaxed. So, but we do have access to our HIPAA compliant platform to conduct sessions for our outpatient families. We are Medicaid providers too. We provide psychiatric evaluations as well as medication monitoring. We come from again, family systems approach. Case management is crucial. We believe that every family should have the very basic needs met. You cannot treat someone with an empty stomach, or you cannot treat someone and their lights are out. So those are very basic needs that a family must have in order to focus on their emotional, mental health challenges. We also serve as I guess, link to other services in the community. We have bilingual Spanish-speaking team members. Our office hours are Monday through Friday through Thursday from 9 a.m. to 9 p.m. and on Saturdays from 9 to 2 p.m. We believe in a continuity of care with our FIS clinicians who do outpatient services and IIC or vice versa. So most likely the same clinician who work with a family with our IIC program will work with the same family and the same clinician in our outpatient services. We also use early childhood expertise with case consultation and supervision. We do have a sliding fee scale for self-pay. We always have, and we know that transportation is a big challenge for our community. So logistic care, it's something that we have used, and also Uber as a backup. We provide, weekly supervision, and this is not, something that the agency takes lightly. LSWs, excuse me, and LACs receive weekly supervision because as per regulations, and because we want to ensure that we provide the best clinical service available to all our families. So we come from a systems approach. We treat children, families, adults in our East Orange location. We also have a part of our patient that is called Early Steps to Success program. And basically we focus on increasing the positive attachment and promoting behaviors that strengthens the child and the caregiver. This is not your traditional play therapy. This is something that the agency began to explore more than 5 years ago. And we have one of probably 16, 17 clinicians in the state with the certification from Montclair State University. This program is basically for families with children ages 0 to 5. And it's evidence-based in order to provide step treatment. So the Early Steps for Success program provides—
1 minute left, Gino, sorry.
That's okay, that's all right. So we do a lot of educational support, goals, interactions. We also work with children, infants that are nonverbal in communication. So in a nutshell, we will work with all those children 0 to 5 and everyone in our office in East Orange. So our information, I don't know if I could share later with you, Joel, and we could send it to everyone, but we are more than happy to be part of this collective group of agencies that want to do the best for our community in Essex County. Thank you.
Thank you. And yeah, any resources that you guys have, any documentation that you have, if you don't already know, we do have a weekly Resource Tuesday email that goes out with any events, resources, or information. You could email Julia. Her email was in the chat box already, but you can email Julia and send that information to her, and she'll make sure that we distribute it to the wider audience here.
Fantastic. Thank you, Joel.
No problem. Thank you, Gino.
Thank you, Gino.
Next, we have Donette Green, Resource Development Specialist for the New Jersey Division of Child Protection and Permanency. Is Donette on the line? I don't think Donette's on the line.
Denise is going to do our representation. I'm just here.
Okay. Thank you.
She's our representative.
So we'll hold off on Denise for now. We'll pass it on to Danielle Barsh from the New Jersey Poison Control Center.
Hi, thank you. With the Poison Control Center, we have been operating as close to normal as possible. We are still, all of our services are still available. So we're available 24/7 to answer questions, provide information, or emergency support about pretty much anything that can make someone sick, hurt them, or kill them, especially those things, that would do that when used in the wrong way by the wrong person. All calls to the Poison Center are free. They're always answered by medical professionals. We have seen in New Jersey, as well as poison centers across the country, have seen surges in calls as people are staying home more. We see a lot more accidental poisonings, and even with people being concerned about going into hospitals or are unable to reach their primary care physicians. We've seen more callers, especially things with cases dealing with cleaning products or disinfectants. And generally things that are around the home. We do also take calls for questions about medication safety. So we've had a lot of calls and concerns about medication. We take calls for substances of abuse. So we have seen calls come in regarding people abusing certain substances, whether it's alcohol, prescription medication, anything like that. So the Poison Center is still running, like I said, as normal. One thing, though, that we have also taken on starting in late January, the New Jersey Poison Control Center, in collaboration with the State Department of Health, has been operating the novel coronavirus COVID-19 information hotline. So this hotline is monitored 24/7, again, by medical professionals to enable us to keep up with the call volume, because we have seen such a surge in calls with people looking for medical advice or even just general information regarding the coronavirus. We have deployed a multidisciplinary team with volunteers from Rutgers, so faculty volunteers, as well as graduate students, med students, students from the School of Public Health. So we have, a very robust team of healthcare workers trying to provide up-to-date and accurate information to people. And over the last few months, we have received over 25,000 calls to the Poison Center regarding COVID-19. We've seen a lot of calls, or residents have been calling looking for information on testing location, prevention information, medical guidance, trying to find out information about symptoms. Definitely a lot of calls where people may have heard or seen something online, on the news, social media, and they want clarification on it. So, we have been able to help a lot of people get that accurate information, and we're continuing to operate that hotline. 211 is also, operating more for the general information. We've kind of been trying to focus more on the medical needs. And what we've really been able to do is help to keep thousands of worried individuals from making unneeded hospital visits, especially in the beginning of this, the surge in cases, where everybody was very concerned and unable to reach, their own primary care physician in a lot of cases. They were able to reach out to us, and we were able to help link them to services, whether it was telehealth options or help with, finding the help that people have needed. So callers can reach the poison helpline at 1-800-222-1222. And that is a national number. So when you call that number, you are supposed to, in the state of New Jersey, be directed directly to the New Jersey Poison Center. But we have seen, here and there issues. If you have an out of state cell phone or something like that, sometimes we've seen issues with calls being bounced to other poison centers. So for the COVID hotline, because not many poison centers are helping to operate, these COVID hotlines in their respective states, but not all are. So in New Jersey, we've set up a health hotline. So this would ensure that you would be directed to us if you have COVID questions. And that number is 1-800-962-1253. I'll put both of those numbers in the chat box just in case anybody needs them. We've also put a COVID-19 coronavirus section on our website, which is njpies.org, just with, up-to-date information, some resources and things like that. So I'll also put that link directly in there as well. Thank you very much.
Thank you, Danielle. Quick question. I just started to put you on the spot. I just thought about this. Are there any virtual either trainings or webinars that the agencies can utilize for their staff or for their clients related to either, of course, COVID is taking all of the air in the room right now, but either that or just anything else that you've discussed?
So for COVID, we don't have anything specific as far as like a training. I know, we would be able to provide information. I would definitely, be happy to try and put something together if people were interested, just to provide that information. Same thing with the Poison Center, though. All of our educational programs and things like that, we've been trying to, some things we had already had planned. We've done via conference calls or Zoom to provide information and try and get some training out there just to make people aware of the poisons that may be around their home, or to let them know, again, a lot of calls we get, both to the poison line and the COVID line, will have to do with like disinfecting. So we see a lot of calls where people want to know, I went and bought apples, can I wash them with my dish soap? So, we do have those resources available as well to do a training with that kind of information. And I'd be happy to set something like that up.
Awesome. Thank you so much, Danielle.
Not a problem. Thank you.
Next, we have Deshonda Renfro, the COO for Project DART. I believe Deshonda is on the line.
It's my turn. Hey, everybody.
How are you?
How's everybody doing? Thumbs up. All right, guys. I'm happy to be here. I know we're in some trying times right now, and we're all trying to continue servicing clients and do our good work in the community. Well, I'm going to get to the nitty gritty so we can move on, but I hope everybody is well, COVID-19 free. I hope everybody's been tested. I'm COVID-19 free, so I hope everybody else is. All right, Project DART. I started Project DART in 2018. I'm a social worker, and I found my gift in group facilitation. I started the business off facilitating groups. I love therapeutic, didactic group sessions. I find them to be very beneficial for clients and youth. The population that I deal with the youth. Most of my clients are from Essex County. And the Project DART's core mission is to motivate, inspire, educate, build self-esteem, and reinforce positive communication skills amongst youth. We live in a time now where so many of our youth are dealing with anxiety, depression. So during this time, I've pretty much been functioning, as as normal. I've been doing my group sessions. I had to get creative with the times. You know, normally my youth like to come in and sit in the therapeutic group circle and engage, and they love my snacks that I give them. I cut the best apples in the world. Unfortunately, they can't come and get none of my cut apples, but I'm still continuing my group sessions via Zoom. And my group sessions are cognitive behavior therapy driven, existential therapy driven. I've been continuing to participate in my Girls to Queens group via Zoom. And I pretty much, most of my girls, they've been in attendance. I've still been able to do my Boys to Kings group. And just so you guys know, the Boys to Kings and the Girls to Queens, the group core focus is self-esteem building, inspire education, and I'm big on art and cultural exposure. So with COVID-19, that had to be slashed. So I'm a little sad about that, but I've been getting real creative over Zoom, you know. I've still been able to do my anger management. I offer a eight-week anger management class for adolescents, and I still been able to do it. All my adolescents, normally I service adolescents from the age 12 and up. And I also been able to continue to do my life skills. And it's a 6-week session as well, adolescents in Essex County area, 12 and up. And what else has been going on with me? I just believe that all of us as change agents and helping professionals, we have to stay creative. You know, we have to get very comical because people are stuck in the house. And believe it or not, a lot of the youth, they continue to sign in to Zoom because I think it's that consistency, that weekly thing, those 90-minute groups that I know I'm going to be able to engage. I can get a little laughter. I can talk about what's going on within my home and get, you know, be provided with the proper tools to learn how to resolve those issues. So it's been challenging, but I will not let that stop me from doing God's work and serving the adolescents of Essex County. I will continue to get creative. Zoom is my new tool that I will continue to use. And that's basically it. And if you guys have any youth that are interested in therapeutic group sessions, my sessions are weekly. They're 90 minutes. I send them the link, and that's about it. And the only problem, I can honestly say, the only problem that I've had a few of the youth that I serve is their family, due to the COVID-19, probably before then, they were battling, you know, dire socioeconomic, you know, needs. They were in a drought. So some of the families don't have internet access. They don't. And a lot of them, you know, they come to the group session via cell phone. They'll go somewhere where Wi-Fi is. So my heart kind of goes out to those individuals that can't afford the Wi-Fi to get the technological services that we all have to offer now. And so that's it for me. I'm still here. Any referrals, they're welcome. I'm ready to continue working and serving, and I want everybody to be safe. And that's me, Deshonda Renfro, Project Art.
Thank you, Deshonda. Really appreciate it. I think Anne-Marie is not on the line. I did not see Anne-Marie on the line from Spectrum Works, but we do have Leslie Lester here. Leslie is a psychologist and parent-infant services coordinator for Youth Consultation Service, Institute of Infant and Preschool Mental Health. With that, I'll mute myself and pass it on to Leslie.
Good morning or good afternoon, everyone. I hope that you're well. I share the greetings that many of you have, and thank you for your work for our community. So as Joel said, I am a psychologist and an infant mental health specialist as part of Youth Consultation's Institute for Infant and Preschool Mental Health, which just is a really long name to say that YCS as a larger organization, Youth Consultation Services, we're the largest provider of mental health for children in the state, but most of what YCS does is residential treatment facilities. And they do wonderful work helping children with autism and special needs in residential facilities. And we are actually the arm of YCS that provides services, therapies for children ages pregnancy to 7 in our East Orange and Union City Clinic. So we are very, very grateful to be able to work for and with the families that really need infant mental health specialized services. So what that means is that as a training clinic for doctoral therapists, for psychologists, we are specially trained in infant mental health principles, helping to keep the baby in mind, how to recognize the needs of the child, what they're feeling, what they're experiencing, and helping their caregivers to think about that. And as many of you mentioned, even without a pandemic, so many of our families are facing struggles from trauma, from drug addiction, from having a hard time finding a job, stable housing. It's so hard just to function sometimes. Even under the best of circumstances, it's really hard taking care of a small child. And so we really recognize the systems for which our families live and want to honor that and help them to get support, but also to honor their intentionality around supporting the relationship that they have with their child, because we know that children who are thought of do better in life. And that's a very common, understandable concept, but helping parents to have room in their heart and their head for their child, and thinking about how to have parenting practices that reflect their own core values, their own cultural values, their family values, but also allow them to support their child to make good choices. So oftentimes we see maybe a 5 or 6 year old who's getting in trouble at school, or not listening at home, or tantruming, or falling out, right? The parents are struggling just as much as that child is. And we don't want that child to have to continue to have that behavior, or struggle with anxiety, or struggle with bullying at school by themselves. We want them to have a support in us. So we provide specialized play therapy for those children, but we're never treating the child by themselves. We're always thinking about how do we help their system, their family, maybe an aunt that comes to visit in the evening, maybe they're with grandma on the weekend, whoever is part of their family system, maybe they're taken care of by a neighbor after school. We're really thinking about their larger picture and helping those caregivers to be able to know, first, how do we help this child so that they can make different or better choices or manage their feelings in a different way, but also to help them to know how to parent this child differently. Maybe they have special needs, maybe they've been exposed to a traumatic situation, and the child's coping, but also the family is too. So oftentimes, unfortunately, when a trauma happens for a small child in Essex County, we get called because we are specialized in training in working with such small children and the effects of these indicated catastrophes on them and their families. So we're honored to work with those families, and that looks differently for each family. So not only do we provide services for pregnancy to age 7, those children and their families, but we're also mindful of the special work that is provided under our Baby Steps program, which is the program that I oversee. And that's really the pregnancy to age 3. So in this program, we're mindful some families who are pregnant or have a small child really benefit from a one-on-one setting. They're much more comfortable sharing about their struggles, sharing about their concerns about their child. Is my child developing? What can I do when they tantrum? You know, this is my 6th child, but I lost the other 5. This is my chance. We're really mindful of how to help parents to think about their child from a developmental perspective. And so each of the children that come through our doors, we offer a developmental screener and then provide on-site psychological testing as well. Now, the screeners are still able to be provided on our current telehealth platform. However, the psychological full evaluations are on pause for now, unfortunately, and will resume when we come back to the clinic. But every parent that comes through our door whether that's grandma, whether that's a resource parent, whether it's mom or dad, can have a good sense of where their child is. So maybe they're working with we're working with a 4-year-old, but inside the child's more like a 2-year-old. That's really important information for that parent to understand so that they can adjust their expectations and adjust their discipline and help them to be the best caregivers. So as many of you have spoken about, we are also very strength-based because so many of our families have experienced systems or authority figures that have told them that they're not good enough, that something's wrong. And we want them to know what they are doing well. Of course, if there's something that we can do to help them to get them back on track or help them to understand their child better, we're going to give that feedback. But we believe that the relationship that we have with our families is really the tool for intervention, because if we're able to support the families, especially the caregivers, in helping them to have a space to process what's gone on, then they can share that with their child and be more empathic and more sympathetic to that child's experience. And so we are a very holistic approach. And so as I mentioned, some of the services we provide are more individually based for our young kiddos, which we call dyadic therapy with the parent and child together. But some of them are more group-based. So many families feel more comfortable in a group setting. So we run baby steps support groups, which is now happening, and we've just restarted after a brief pause as we adjusted to telehealth and being on Zoom. And so we're very excited to be able to provide services services in a group setting for our parents. So in brief, if you are working with a family that has a child under the 7 or younger that's really struggling, or a parent who's newly pregnant, please give me a call or email me, and I'm happy to chat with you about what services we can provide. We are a Medicaid clinic. We speak English and Spanish. We help families to access our services with transportation, and we provide services in individual and group settings. I think that's mostly everything. So we're very happy to partner with the families that you are servicing already. And my email is there. If you prefer to just reach out via telephone, I'll put this in the chat box as well, but you can reach me on the work cell at 201-492-1568, 201-492-1568. Thank you so much. And thank you, Joel, and everyone for putting this together.
Thank you, Leslie. Appreciate it. Next, we have Yvette Eastwick. She is a volunteer and a retired nurse in her own right, and a very esteemed member of ADAPT. So I'll pass it on to Yvette, and I'll mute myself. Got it, Yvette? Let me help.
Well, can you unmute her?
Can you hear me?
Yes.
Okay, I'm Yvette. I'm from the Family Success Center. I am on their board. Joel, I just got a text back from my director, Kiera. She said, yes, you can display the information. Our mission is to create pathways to success. So at-risk and underserved residents of urban communities throughout innovative behavioral health, mental health, residential, and educational programs. I'm just going to tell you some of the programs that we do. I am on the board of the Family Success Center for over a decade now. The East Orange Family Center is operational at the East Orange Family Success Center for 11 years and served over 350 families annually. The center serves as a starting point to help families thrive by working with families who are in need of a variety of family-centered support. The staff maintains a steady flow of services, information, and partnerships to help families find the resources they need to become self-sufficient. We at the agency is funded partly by the state, and we do have some private funding. Some of the services for parents and their families our resources, connecting family to services through referrals. We have family gatherings, but we have to revamp our program to see how we can do that via Zoom. We have a share program, which that's on hold for now because of COVID and the drop-in activities. We do have active parenting, which we do every other Saturday. I think the last meeting we had, they are doing the active parenting on Zoom. Miss Price, she is one of the parents that is teaching them. We do have after school. They did say they're going to continue doing the after school because we realize that a lot of the parents do need help with their children, especially now. My director there is Kiera Kaiser. Kiera Kaiser is, I'm speaking from what one person from the community label her as, because usually when we go out, I usually don't stand near to where they are, but what I do is I usually go in the crowd because I want to hear what the opinions of the crowd are. And I was proud to say, and I did tell her, I said, you know, what I heard is that you are an active, somebody that really goes out there, an active director, somebody who goes out there and makes sure when the parents need housing, if they need financial help, if they need whatever their needs are, Kiera is there to. And we also do have two parents who go out and who, you know, they're at the center. The center is closed now, but at the same time, they are still working. The number for the center is 973-395-1442. There's an extension if you can speak to either family partner, Amina Hassel, or Natasha Akiente. We also have a new staff member on board. I haven't met her since the COVID because when she came on staff, it was at the closing of the center. But what I was told during our last Zoom meeting is that the center still continues to function. So you could call the number and they still try to do whatever they can. Also, we have a financial literacy workshop. I don't know how some of these programs have stopped since the COVID, but we still try to reach out to families who need help. Two other programs that I would like to say that we do. We do the Kumba, which is an early childhood literacy-based workshop to teach parent creative and engagement play activities for children ages 3 to 5 years old. Activities emphasize speech, language, developmental, motor skills, and developmental milestones. We have the Sankofa Academy, that's the after-school program, which I was talking about earlier. We also do healthy relationships and empowerment workshops. Thank you very much.
Thank you, Yvette. And we appreciate your efforts being one of ADEPT's Interfaith Steering Committee members for the past several years now.
I just had a quick question. If Yvette can make sure that she puts the phone numbers that she mentioned in the chat, that would be great.
Okay.
Thank you.
You're welcome. You know what I sent it to, and I'm not ashamed to say it, I am just learning how to do this Zoom thing because right now, you know, like many other parents, we have to coach them into getting to I can get on the Zoom, but I will send it to them. We also have a grandparent program, which we do on Zoom.
Yeah, you can send it to me and I'll make sure we get it on.
Okay, thank you very much.
Thank you, Yvette. With that, I'll pass it on to Karen Benjamin. She's the director of the Essex Pregnancy and Parenting Connection.
Hi, everyone. Thank you, Joelle and ADAPT for putting this together, and everyone who was involved. I think it's a great idea. EPPC, Essex Pregnancy and Parenting Connection, serves Essex County families who are either expecting a baby or who have young children. And there's really two takeaways I'm hoping you get from my couple of minutes. One is that probably, as you know, and I'll just remind you, there are a lot of great programs in Essex County available to support families. And two, it can be easy to connect families even during this pandemic. So in terms of some of the great programs, many of you are, on the call here. A couple I just wanted to mention that we've worked very closely with, especially to support expecting families and those with young children. Home visitors, we have numerous home visiting programs in Essex, and they can go right to the client at their home in typical times. Right now they're doing telehealth and remote kinds of visits. And they can support families all the way from pregnancy up to when the child is a toddler, or even some programs serve school-age children. Community health workers, we have several programs of CHWs working with clients on some shorter-term kinds of needs and navigating services. So they are also available to families and, had worked remotely in the past and sometimes met families in person. They're also now still, they can now work remotely during this time. We also have free community doulas who can support women before, during, and after labor. That's really important, especially to a woman who does not really have support, and also to help them advocate for having the experience that they hope for. And they are also doing their support remotely. We connect families to a lot of different support groups. There's some like free low-cost Lamaze sessions for women who are pregnant, families who are expecting. I know Dr. Lester's on the line and FIS, and we can refer families to different groups that are happening to dyadic therapy for families to learn more and develop their parent-child relationship. So those are just some of the programs that we connect families to. We also share out and sometimes offer parent-child activities. So when we used to do them in person, now we're doing some of those remotely online. We will have an infant massage and music together sessions that are coming up soon that we'll be promoting. We also always offer an online tool called the ASQ, and that helps parents with young children learn more about their development and their milestones to be watching for. So we follow up with the families that complete the online ASQ, and then we provide activities and materials to them through the mail. And we have conversations with them over the phone, answer any questions they have, and link them to other things they might be looking for. So again, there are a lot of programs in Essex. They have different eligibility in terms of who they can serve geographically, or whether they only serve pregnant or some serve pregnant and postpartum or older. And so they all also have different contact information, so sometimes it can get overwhelming, especially if you're a provider trying to connect a family to something, or if you're a parent trying to find something. So the way that we can try and make it easy is if you have a client, if you are a provider and you have a client who wants to be connected to something, you can use our one-page referral form that I can share out. Families or providers can also contact. We can be called, texted, emailed. We're on Facebook. We're now on Instagram, YouTube, and we also have a website with some of our forms and resources. So I'm happy to answer any questions that people have, but I hope from hearing this you're just reminded that there are a lot of great programs in Essex available to support families, and it can be easy to connect them, even during this pandemic, by letting us at EPPC assist you.
Thank you, Karen.
You're welcome.
Over for our presentations. My good friend Sheena, even though she says I put her on the spot, I did not put you on the spot. I got you muted because I know you started with bad mouth for me, so I'm going to unmute you now, though. Hi, Sheena. Sheena's with NJCRI.
Yes.
I'm going to have Sheena.
Hi, Joel. I'm unmuted, right? I'm unmuted.
Yes, I hear you, Sheena.
Okay. So, hi. I'm actually sharing something that I've been hearing from the community. Give me one moment. Okay, I'm back. You know I'm always writing. Evening, my name is Sheena Dance. I am a research data collector for NJCRI. I'm contracted to the New Jersey Department of Health and the Centers for Disease Control. What I do is I engage individuals who are living with HIV and see where they are in terms of their health care and social supports by way of a confidential public health survey. And when the survey is over, besides the fact that they get a $50 gift card incentive, I also, if, you know, on a case-by-case basis, connect the individuals to whatever resources they need. And it doesn't matter where they are in the country. It's whoever they assign me to, those are the people I work with. It's usually between 125 and 160 people each year. Speaking of NJCRI, which is located at 393 Central Avenue in Newark, which has been around over 30 years, it started out as a substance abuse community organization in the beginning. A lot of it was founded on the available research at the time at the outbreak of, well, HIV and also the heroin epidemic at the time. They've moved on to children's health screenings in a pediatrics unit. They have an extensive behavioral health division. They do general counseling. It consists of anything from trauma to substance abuse, depression, anxiety. They have 2 substance abuse doctors there, several licensed clinicians, and they also do other programs like groups, whether it's group counseling as well as support groups. And we have various types of support groups. Some are just geared towards women, minority women, but it's open to everyone. We also host, well, COVID has impacted a lot of things, but when we're, you know, our normal day-to-day, we hold weekly NA meetings, and we might have anywhere from 50 to 100 people come in every week. They have spiritual counseling as well. So it's like a combination of spiritual, it could be HIV and substance abuse. And that's usually an older population. I would say like baby boomer population. The other services we provide, like myself, I do research, but we have various areas of research that we focus on: homelessness, HIV, substance abuse, LGBTQ, MSM, which is men who have sex with men, things that specifically affect them. We also are about to do some COVID research. I really don't know the details, but we're about to do things on that nature where we're doing baselines, which I actually did it today. We also do several hepatitis C types of research with individuals who are 55 and older. It's 55 or 45 and older, I forget, but it's hepatitis C. We have a needle exchange program. So individuals come from New York, they come from all over Essex, they come from South Jersey, and that's still going because they have a van set up outside in the parking lot so people don't access the building unless they're actually sick and need to see a provider. But we do the needle exchange. We take the dirty needles and we give them clean needles. They do wound care. There's an arch nurse who does wound care. They do assessments. They also look at any other needs that they may have, and then they direct them to the appropriate department or other outside agency in the community. We have a pharmacy. Most of our services are 540B funded through the federal government, state, et cetera, et cetera. So there's an on-site pharmacy as well as a lab core. So that way, when we get people in, which most are very difficult to retain and care because of social economic reasons, inability to get around, everything's on site. We also do outreach into the community, so a van goes out daily and distributes food, mainly in Newark, but they go everywhere. So we have a food pantry, and usually you assess what an individual needs. So they say, I need X, Y, and Z. They put together, I guess you could say, a care package, and they actually go out and deliver it to the homes. We have a clothes closet for people who are in between jobs and they need appropriate clothing to do an interview. We also do interview support services. So they have a computer room, people can come and, they work with them on their resumes and so on and so forth while they're trying to transition to employment. One of the biggest components of the agency is the homeless programs, and we run several. So one is for young people. I believe their ages are 17 to 26 or so. And it's a mixed bag because it's LGBTQ, but it's also heterosexual, and it's multicultural. The kids are from everywhere, and they just feel, I guess, sidelined or different or whatever, and it's a safe space for them to come to. They have all types of activities. They have 2 kitchens. So not only do they cook, the adults who run the programs cook for them too. So they always have a hot meal. They have the widescreen TV, they have a sound system, they do videos, they do media campaigns, they do community outreach. They do so much right now, and they have this huge virtual campaign going on now. So I guess the young people get to chat with each other, and they contribute their ideas to come up with more campaigns. They also do voguing, and they do shows. They have a few shows coming up now. So it's a very interesting group, and everybody that runs that program they act like parents, but they're not much older than the young kids that come there. So it's really an inviting program. And then we have the adult LGBTQ drop-in center, which is located at 15 Academy Street, 12 Academy, 17 Academy Street in Newark, with Jason, who is on the LGBTQ committee with ADAPT, is the manager there. So they do a lot of emergency services. So it's healthcare, it's education, it's different types of prevention programs. They also have their own virtual activities. I believe there's one tonight. And they do a lot of media campaigns as well. And my time is up already. They got a lot of programs. What do you want from me? And then there's the general homeless drop-in center. So people come there, they get food every day. They can get medical care if they need it. They can get referrals. So it's whether it's in-house or outside. And what their main job or main focus is to make sure whomever comes to the door gets placed in shelter before the day is over, which ends at 4 o'clock. They're very successful. They have a lot of clients that come there. But like everywhere else, the homeless situation is pretty dire. And they are testing, I believe, the homeless population. They're working with Rutgers and some other entities to really address that. I don't know what else, Joe. I don't know. Every year we have 2 huge campaigns. One is the New Jersey AIDS Walk. We pretty much spearhead that. This year was the first time we did a virtual AIDS walk, and it was very successful. They raised a lot of money and a lot of people participated. They did iPhone videos or whatever, different types of videos, and they submitted it to show that they were walking for the cause. The other main event that we do is World AIDS Day, which is held every year, December 1st. If you need any information, there you have it. You can find me there. You can also visit the NJCRI website, www.njcri.org. They're also on Instagram, Twitter, and Facebook.
Awesome. Thank you, Sheena. Much appreciated.
I'm trying.
That was thorough. Thank you.
You're quite welcome. And I speak fast. I apologize, but it's a lot to.
Actually, just had a quick question.
Sure.
So all of those services now, what are you guys doing for COVID?
Well, the way it works, we have medical vans in our parking lot. So a lot of stuff like, which I totally neglected. We do a lot of telehealth, telemed. So the clients can talk to the doctors, they can talk to the nurses, they can talk to the researchers. And matter of fact, most of the work I'm going to be doing is going to be telephonic, not virtual, for reasons, confidential reasons. And it's the state and the CDC. You can't see, you can't touch, you can't do whatever. Everything is anonymous. But they're doing a lot of, they immediately, the first day that the governor was hinting at shutting down, which was like March 10th, I'm gonna say, 13th, they immediately switched to telehealth and telemed for the majority of patients who can. They also have a system in place where they can call and talk to a therapist, a doctor, an outreach worker, whomever they need to talk to. So they can, they can text, they can call. If they have access to, a computer, they can do the virtual thing. We also still do outreach. So if someone really needs assistance, they send a van out to them. But the way it works for COVID, so they have several medical vans, and they were outfitted or refitted with the screens and everything, to deal with the COVID situation. Once a person enters in the parking lot, their temperature's taken, and they do a actual COVID screening, which is the one that's used by the New Jersey Department of Health and other entities, I guess. And then from there, whatever it is they need, then they direct them for that. Some things can be done directly on the van. They can get rapid HIV testing. They can get other STD testing, syphilis, gonorrhea, so on and so forth. And then there's always a nurse on staff that can go out and talk to them. And if they need the doctor goes and talks to them. They're still holding counseling sessions inside. They have rooms refitted, outfitted where there's like a 6-foot or 10-foot table, and the client sits on one end and the therapist sits on the other. So they really did a lot in terms of like immediate to make sure that the patients don't fall through the cracks as much as possible.
Okay.
Did I miss anything?
Thank you.
So everybody, even us, when we go there, we're not allowed in the building. We get our temperature taken. Everybody gets tested. They get the nasal swab or whatever. And lucky for us, we get our results within 24 hours, unlike what's been going on elsewhere. So it's within 24 hours. If anybody comes back positive, they quarantine or get the health care that they need. And then they have to come back with 2 negative test results before they can re-enter the facility. But most of us can, most of us can actually work from home. So.
Okay, I don't mean to cut you off, but we have to move on to the next
I know.
Okay. Thank you so much for your information.
You're quite welcome.
Thank you.
And I needed your information, so.
Now we have Paula Blanton. She's a SAC and crisis social worker over at East Orange Public Schools. Paula, I'll mute myself.
Hi. How's everyone? Hello, can you hear me?
Yes, we can hear you.
Okay. My presentation is going to be a little bit different. I have to thank all the agencies that we are using. Right now, my colleagues and I are trying to prepare for the new normal, what we're going to have to do if school does happen to open. So I'm going to talk a little bit about that. I want to thank Erica because Partnership for Children of Essex and also Perform Care, they're routinely in my building. So I have met many of the case managers that come in and thank them for their help.
Thank you.
You're welcome. Okay, first of all, we have been meeting approximately 2 weeks now. The school counselors, the social workers, also the assistant superintendent. As you know, some of the logistics of trying to open a school with young people, and these are just some of the few things before I go into what the counseling department and the social work department, what we think we need to do. Mandatory mask wearing. The question has already been thrown out. Who's going to be responsible for getting 1,000 masks daily for some of our schools with some of our young people? Is it going to be the parents or the school? Health and temperature checks throughout the day. Who is going to provide that? And also another question had come up. If you're asymptomatic, you're not going to have a temperature. So how are you going to know if that person is truly carrying the disease or not? Also, children who are riding the bus, how do you social distance them? Some of the other things are the constant disinfecting of the schools, staggered reentry. Are we going to have A and B days or C and D days? Are we going to have days when children are online, then they come to school maybe one day a week? There's so many things that they're saying that we may or may not be doing. They say once we come back, we may not have gym. We may not have the children in the cafeteria because of the numbers, and because it's hard to social distance with young people, they will probably be in their classrooms all day. And I'm talking about the high school children also, that the teachers may be rotating. Also, extracurricular activities that our young people are used to having, they may not be forthcoming. Also, how we're going to deal with children who have not even been on social distance learning. We have over 400 students who have never participated. What do we do for them? Okay, now I'm going to talk a little bit about what the counselors, what we had thought we needed to do when school started. We have also recommended, because of the nature of this being the social emotional and emotional part has to be done, we want our teachers trained. All of us need to be on the same pages. We have teachers who have personally experienced someone in their families who have come up with, who have died or had the virus. So they need to also be emotionally well, besides the counselors and ourselves. We thought we need to do a needs assessment. We need to do it on an individual student. Some students may not have experience. They may have had an easy time of it. We also may have had students who have had a hard time of it. We need to have different categories. How are we going to offer the counseling services? We do want other agencies to come in if possible. We need to have times when we can decompress. If a student is having an outbreak, how are we going to handle that? So these are some of the kinds of things that we have come up with. We have no definitive answers because of the fact that right now government does not know whether or not we are opening in the fall. So thank you. If you need to ask questions, you may.
Oh, a quick question. So you said that there were 400 students who still haven't logged on to their social learning classes?
Yes.
Wow. Wow.
That's just in the high school.
One school.
And we have heard that some of our young people are working full-time to supplement their family's income because the parents are not able to work or something's happened and the parents have been furloughed or lost their jobs. So some of our older students have stepped up. They're like old enough to work for Amazon, FedEx, or even the fast food chains. So many of them are too tired, unfortunately, to log in. And we have students, unfortunately, and I have been told, because I had to intervene with a family, with a young man who we knew before I left school, we had recommended him for a substance treatment program. And unfortunately, he has just really become a crisis. And because he's 19, he he has to make the choice. The family can't. He's left home, in fact. So we have a number of issues that are going on with our high school students.
So a lot of, it's good for you to mention that because a lot of the agencies need to know that so they can know how to support you and our children.
Yes, this is very good because we're going to need a lot of support. This is going to have to be a community effort.
Thank you, Paula.
You're welcome.
Next, we'll pass it on to Judy Bennett. Judy Bennett is from Programs for Parents. And I'll mute myself so that Judy can speak.
Okay. Good evening, everyone. My name is Judy Bennett. I'm an independent consultant with the Programs for Parents, representing this evening Essex County Council for Young Children. The council is one of 21 throughout the state. Our target population is birth through 8 years. So we basically work to engage parents, leadership development, and advocacy for their children. Our three major areas of responsibility are education, health, and safety. Under education, during the situation that we're all faced with right now, we were able to offer all of our parents at home a reading supplemental program, especially in an area like Montclair, which is affluent, and I don't know if folks really are aware that there's an extreme achievement gap for brown and Black children in Montclair. Under health, we have a national initiative, ACEs, which is Adverse Childhood Experiences and Trauma. You know the calls have been coming in from everywhere because now we're not only going to have to deal with trauma in children, but trauma in their families and trauma in the communities. And how do we really address that? Programs for Parents themselves is the Essex County CCR, and they're responsible for providing subsidies for working parents and parents still in school, whether it be college or vocational training, so forth and so on. In addition to subsidies, they provide training for all child care providers, those seeking to be child care providers. They do a lot of community, or not so much communities, but a lot of quality improvement within child care centers, so forth and so on. A couple of events that we're planning virtually, and I mean, we're really being these initiatives to see how we can pull them off. For 5 years, we've done a community event called Family Fun Day, where we've had over 500 people in Military Park on a Saturday morning. I'll be in a planning meeting tomorrow to see how we can pull that off virtually. And a pre-Father's Day breakfast is under development as well. Questions? Well, let me talk a little bit about the local levels that where we work. We have an active council in Newark. We have an active council in Montclair. We're looking to develop councils in East Orange, Ms. Blanton. We're looking to, and I've been working with Mr., I want to say his last name is Latif, with the younger children in East Orange. We're looking to develop in Orange, and all of those councils are in the very early stages of development. I'm very impressed by the presenters this evening because parents have a variety of issues that they need to address before they can even advocate for their children.
Understand.
Definitely agreed.
And we're looking to partner with any and everybody. I mean, collaboration is the key to everything when you're working in our communities throughout Essex County. Even though they may differ they all face the same problems one way or another.
So true. It has to be collaboration.
I may not have used my whole 7 minutes, but if you have any questions, I'm always available to address them.
Perfect. Thank you so much. Next, we have Ratna Joshi. She's a family coordinator from Care Plus. Ratna, I'll mute myself so that you can speak. Are you here? Let me see. I'll unmute you. There you go. Ratna? Hello?
Can kind of hear, but it's bad connection.
There.
She may need to turn her volume up.
Ratna, you're unmuted. Hello?
Reaching and stuff.
No.
I think I hear somebody speaking.
While we're waiting on Ratna to join us, one thing I failed to mention, there is a wealth of resources online that's established by the Programs for Parents at www.accessnewark.com, and I'll put it in the chat box. If your agency is not listed, send me an email and I'll make sure that it is, so that when parents go on looking for help, you're there and readily available.
Awesome.
I like the Darcy, but two Darcys with the same color.
I'll also plug, while we wait for Ratna, I'll plug the fact that we had a brainstorming session 2 weeks ago. We were looking to discuss how, even though we work in substance abuse prevention, we work in the field of public health, and we're aware of various issues that are impacting our communities. And just because we work in substance abuse, we don't just want to ignore and act like we're in a silo and that other issues don't impact us. So we're trying to expand the knowledge of all our partners and brainstorm on the fact of we need to work together rather than in silos. We need to look at upstream and look at what the root causes are to a lot of issues that are impacting our communities, and talk about the systems that are impacting people. So we're looking to have that as something that's, I'll probably record that just to have that as a session on its own to share with you guys. And then I want to make sure that we can have that deeper conversation when it relates to it. So let me see if Ratna's available. Ratna? No. Ratna's not talking. Hello, Ratna? No, we don't have Ratna.
She's muted.
Muted.
I just muted her now. I think she stepped away from the computer.
Oh.
So does anybody have any questions or? No.
I don't know if I have a question.
Any upcoming events?
Let's see. Upcoming events. I had mentioned in chat box about the virtual town halls. I think Jessica can see it. I don't know if anybody else can see it. Yeah. But I think it's really important because I really read what everybody types during these town hall meetings. And it's like repetitive. The seniors who can't go out need assistance. Usually it's food. The parents are overwhelmed, as well as a lot of, mostly the parents. And there's, depressed, anxious. And they're like, where can we get help? And I always, mention ADAPT and the other agencies, but I think if you guys would participate, and a question happens to pop up from the audience, you could say, hey, you know, you can contact us or whatever, or you can shoot an email to the mayor's offices. So I know every Thursday night, East Orange does a town hall meeting with Mayor Green. He's had Governor Murphy on there, Sheila Oliver, doctors from Rutgers, East Orange General, Assemblywoman Brittany Timberlake, you know, and pretty much people are sharing information, but to me it's the same over and over. And a lot of the things that are being shared may not fit for a lot of the people who need help. And I mean, it's mostly like these parents, they're overwhelmed. You know, one person said, you know, I didn't even graduate high school. How am I supposed to help my kid with their homework? You know, or someone who doesn't have a computer at home, as Ms. Blanton mentioned, so they can't even, you know, they're falling more behind than what they already were. So, I mean, that's where the telehealth services, the mental health, that I'm sure ADAPT can provide, services to assist parents with children, especially the single mothers, and just services for people who just keep asking. I mean, I don't, it's like they don't even go, or it's sort of like you keep saying, go to the East Orange School District website, or go to the City Hall website, or go to the New Jersey Department of Health website, go to the CDC website. But I think, I don't know what the resistance is, because even when the information is presented, they still ask the same questions over. And we're talking sometimes 600, 700, 800 people are on these town hall meetings. I think if a parent is talking about their child in East Orange and someone from East Orange is on the town hall representing, I think they would pay more attention. And
So the
you know,
town halls happen.
it's every Thursday at 6 p.m. You can access this through Facebook.
Every Thursday at 6 p.m.?
Yeah, East Orange City Hall, I think it is, and you'll see Town Hall or whatever, or you can contact the mayor's office. But they're very interesting, and it's not even what they're doing, it's more interesting of what people are sharing from the community. It's depressing, actually.
Okay, so the virtual town halls are happening different times, I'm assuming,
Yeah,
for every
I
municipality?
forget what Newark is, but I know Mayor Barack does one he does one every week as well. You know, housing is, rent is a big deal for most people. Most of the people say they cannot afford to pay their rent. And the landlords are threatening them, you know, late payments. As soon as this is over, you're going to court, you're going to get evicted. So there's a lot of stress on a lot of levels.
So Joelle, maybe we can try and get the listing of the different town halls for all the municipalities and share it. Since that was a suggestion that we, you know, be a part of those town halls, that's a great idea. Thank you, Sheena.
Yeah, and I mean, you could even try to get on the guest list and present. I think it's really important.
Absolutely.
We'll look into that. Thank you, Sheena.
And you got friends with the municipalities, Joel.
I think we all do.
We'll reach out.
I'm very
I'll try
glad to hear about what's happening with the schools, with the East Orange School District. It's
Ratna, are you there? You're unmuted. No. I mean, we tried a couple of times. So if not, I'll ask Ratna to come on in a future session. With that, though, if nobody has any more questions, I appreciate you guys taking your time out to present on your programs today. Like I said, we'll combine that with the previous afternoon episode, and we'll bring it all together as one.
okay. Can I just mention one thing? If you, Joel, everybody, If you go to the NJCRI website, there's a lot of information on COVID-19 in terms of resources. I know you guys also share resources, but there's a lot of information that might be helpful. And also it's a more detail of the services provided. So, I mean, it can't hurt for somebody to pick up the phone and call and say, hey, I need help, and you have a counselor that can talk. Right in the ceiling.
Is that right?
I'm here. Sorry. We had a connection loss. I got the message, but I didn't get the. I'm like, what? How are you?
How are you? We were about to end the episode. We were waiting for you. All right.
Thank God for Jessica. I'm telling you, it's like I couldn't hear you guys. I'm like, okay, let me try a different phone. So, yeah. So we have family support going on right now for those people who are suffering. Their loved ones are suffering from addiction. We have several programs in Care Plus open right now. We are doing telehealth. We're doing craft support system, craft support, peer support also on telehealth. We have 3 groups going right now. And also we're doing one-on-one with our clients who have loved ones that are suffering from addiction. CSC is doing psychosis for adults and younger children. Also, we have the RISE program that's also offered in your area, which is to peer support for people suffering from addiction. We also have the STARS program that's going out there too because of COVID. So we have a lot of programs. If anybody needs, any information on our programs, hey, Joel has it all, don't you, Joel?
Hi, Ron, are you connected with, so you are connected with Care Plus New Jersey?
Yes, we are.
Oh, okay. It threw me off because I didn't see the NJ in there. I used to work for Care Plus for many, many years too.
I love my job. We have great deal of beautiful clients. They're actually, what I have discovered is that telehealth, people are wanting to get into peer support groups more than ever. So we have a lot more engagement through telehealth than before.
That's good.
Yeah, so we right now have 2 groups with 8 on each. I do telehealth for, I think, 10 to 11 clients. We give them an hour every other day. And they seem to like it because, there's somebody there talking to them, and helping them through, because anybody who has a loved one that's suffering from addiction, it's a hard process in itself, So, that I would, one of these days, maybe Joel will let me present on Zoom of all the services that we do have one of these days, Joel.
One of our upcoming coalition meetings, yes.
Yes, absolutely. But it's been really, really a good set of people. They're collaborating, they're engaging. I have never seen anything like this before. When we're working and going out into the communities, when everything was okay, they were engaging, but not as much as they're engaging now. I don't know if it has to do with that they can't go anywhere or what it is, but this is just, I said to my boss, I said, this is incredible. Everybody wants to engage, so it's been a tough road for these people. And, but we have had a lot of success. My clients alone, I think 3 of them have already gone into treatment. Which is a good thing. And we still continue to support the families even through treatment while they're in treatment. So it is opioid driven, but we do accept alcohol, marijuana, and any other substances. It is a grant funded program, so they don't have to pay anything out of pocket. And yeah, we're here. And if you need any further information, I think my email address is there. Reach out and I'll be happy to give you more information on our program, STARS program, RISE program, CSC, the whole entire you know, Care Plus is even, matter of fact, Care Plus is doing mental health for ShopRite employees at the moment.
Awesome. I appreciate that, Radna. Thank you so much.
Hey, thank you. I'm sorry I couldn't hear you, and I'm like, oh, thank you.
All right, folks. So like I said, this will be posted and shared. We hope that you guys are able to share this information with any residents of Essex County. Along with that, we will be hosting additional sessions moving forward. We'll keep you guys posted on that. For those sessions, we'll wait a little while to keep other people, to get new people involved in sharing first, and then we'll share it. We'll let you guys share. So
Really quick, Joe, I wanted to tell you I have more resources for you guys.
Go ahead.
Okay, no. I'll send it to you through email.
Oh, perfect. Okay.
Okay.
All right, everybody. So with that said, thank you very much and enjoy the rest of your
Thank you.
Good night.